Hello, my name is Kim Quinn, and I've been asked to come here and talk to you about my educational journey and how the art and science of nursing have influenced me through that journey. I became an LPN in 2005 and have progressed since then. I became an RN in 2008. Got my bachelor's degree in 2013 and am now pursuing my master's degree. And I am truly amazed at the amount of information that has been added on to each step of that educational journey. I have spent most of my career in the field of dialysis. I was a dialysis technician before I became an LPN and stayed in that field. And I really feel like that field in and of itself, being the specialty that it is, really helped me to own my craft as far as the art of nursing. The science of the disability hasn't really changed that much through the years. It's still a very, very hard diagnosis and lifestyle for the patients to live. And part of what I did as a nurse, because you spend so many hours a week with these patients, and the educational factor is huge. It's a constant reminder to them, a constant education. For nurses, it's a constant field of trying to find ways for these patients to cope with this diagnosis and to cope with this lifestyle, which is where, like I said, I feel like my art of nursing really was blossomed and is what it is today for me. Because as the nurse, you become the counselor, the educator, the advocate between the physician and the doctor, because sometimes these patients are embarrassed by the things that they're going through. So they tell you as the nurse, and as the nurse, then I intervene and let the physician know. It's also a very hard thing to deal with, patient privacy, because you're in a room filled with these chairs. When the patients and physicians do round, everything is out in the open, and the person next to them wants to pay attention to what's being said to them, but they also want the attention that the other person is getting. So it's a very chaotic atmosphere, not only for the patients but for the staff also. But you get to know these patients so well, and they confide in you things that they don't either want the physician to know or that they don't want their families to know, because it's very hard for the families to understand what the patient is going through. The patients feel very isolated because when they go to family gatherings, they have this terrible restriction placed on them that they can't partake in things like a normal person would. Or they end up in the hospital because they've been fluid overloaded or, what have you. So you're educating the family as much as possible also. And the biggest aspect of this disease process that dialysis patients go through is the fatigue and the isolation, and they want to give up. The only cure for this disability is a transplant, which is a very rigorous process for them to go through. And sometimes, depending on the diagnosis and when the diagnosis is given, transplant's not an option for them because of either other health issues or their age plays a factor into it. And through the years, I have had several patients decide that they want to withdraw from the process of dialysis. So then it becomes a factor of you as the nurse telling them that that's okay to make that decision, because they need to have somebody that supports them in that. And also advocating for them to speak to the families and let the families know exactly how they feel. The science of it is unknown. I mean, every patient is different, so the first thing they want to know when they decide to withdraw is, how long before I'm going to pass? And that's usually what the families want to know. And the science of that is unknown. It depends on the patient. It depends on the other disease processes that they're going through, the other health issues that they have, and how long they've been on dialysis. I actually had a patient that decided to withdraw care after being on dialysis for 30 years. The unfortunate thing for that patient, he had had a transplant when he was very young that failed and decided not to go through that again. But he had also made that decision to not let anybody else share his life with him because of the processes that he was going through. So other than his immediate family, meaning his parents and siblings, he did not have anybody to share that process with him. And as the nurse and knowing this patient for as long as I did, that was just absolutely heart-wrenching for me. But I supported him in everything that he did. And, we talked to his parents as a group, the healthcare providers and I, to kind of prepare them a little bit as best you can. You can never say for sure. Luckily for him, his passing was very quick and very peaceful. He didn't suffer any, which was nice. Sometimes other patients aren't so lucky, and that's the hard thing for the families to endure. And as I go through this educational process, the other factor that I absolutely love about it is the education of the family and the patients, and the fact that if I don't know something, there's a wealth of information out there for me to find it and look it up and give them the facts. And also to be able to work with physicians that have a fantastic bedside manner. They take a lot of time with the patients. They don't speak over the patients in medical jargon. And there have been a few physicians that have done that. And then, of course, the patients look to us as the nurses to kind of explain things to them in terms that they can understand. The biggest thing with my dialysis patients I found is the fact that they feel so out of control. They don't feel like they have any decision-making abilities in this disease process that they go through. So for me, it was finding ways for them to feel like they were in control, saying, okay, look at your terrible diet restrictions. And yes, you have these restrictions, but there's ways that we can do this, that you can still enjoy the things that you used to enjoy. You just have to modify that. And modification is hard for all of us. I feel like the first thing that we're told you're not supposed to do is what we want to do the most. So we try to come up with ideas on how to enjoy a little bit, not overindulge, not end up in the hospital with more complications. The other aspect of that is the accesses that are involved in dialysis patients. So they have a long history of hospitalizations anyway due to their failed accesses and due to complications with their accesses or complications with the surgeries. So that avenue, I feel, really helped me evolve as a nurse into what I do now, and I carry that over now. I hold 2 specialties at the facility that I work at, and I'm still able to take a lot of time and spend a lot of time with my patients and make sure that their questions are answered, and the family members. I find that most patients, when they're going through things, don't divulge a lot to the family members, and will look to us as nurses to kind of help them in that area, maybe pave the way, or maybe even open up that conversation, that hard conversation with them about the patient's wishes, and what to expect, moving forward when their wishes are followed. So I greatly look forward to the education that I'm getting with my master's degree, and look forward to the fact that I can continue on this process and become greater at my ability to do my art of nursing and to stay abreast of the science of the nursing and advocate for my patients and be a strong team member at my healthcare facility that other team members can rely on. So I appreciate all the time that you've given me, and I hope what I had to say makes some sense, especially if you're trying to decide whether you want to continue on with your nursing career. Thank you, and have a good day.